As a TMS customer, you have options, and we want to help you feel confident in choosing a really great location to have your TMS treatment. Coming up, I'll share with you the information you should be seeking in order to make an informed choice. Hey guys, welcome to Real Talk Mental Health, located in Vancouver, Washington, where we talk about real-life mental health topics from the provider's perspective. Let's dive in. You'd be shocked to know that there are actually very few official standards of care for TMS centers and providers across the country, and we find that unacceptable. At TMS Northwest, we are on a mission to establish best practice for TMS providers in order to create a consistent level of patient care and safety standard, no matter where you receive TMS care. So what are the standards that we've created at our clinic and that we would like to see established across the country? What are the questions that you should be asking? Let's start from first contact with a TMS clinic, then through your treatment and beyond. Does the clinic use an electronic medical record? This is important because things are more streamlined and you're able to provide a lot of background in your history. One of the key things with TMS is knowing your background, including your medication history, outpatient treatment history, and the sort. Using an electronic medical record makes this streamlined and efficient. Another question you may ask is, how much time is spent on your evaluation? Most evaluations take anywhere between 45 minutes and 60 minutes. Anything shorter than that is often subpar, not very thorough, and oftentimes the provider can be missing something. And although that the client is presenting for an evaluation, it's absolutely essential that the provider rules out any underlying issues or comorbidities, meaning that do you have depression, anxiety, and ADHD? Is your sleep out of hand? Do you actually have bipolar disorder? Do you have a substance use disorder underlying that needs to be in control? There's so many things that come to play during evaluations, and if that time is rushed, or if the provider is hyper-focusing on just depression, a lot can be missed. Now, when the evaluation is done in a thorough way, the next question is, does the clinic provide medication optimization prior to starting treatment? Why this is important is oftentimes clients that come to our clinic are treatment resistant, meaning they've been on 3, 4, 8, 9 medications. And sometimes some of the medications they're on aren't the best fit for them, whether it be for side effects or because it has cognitive impact or weight gain. There's all sorts of reasons. There's some medications that just shouldn't be taken long term. And to maximize your response and chance of remission, it's absolutely essential that your clinic attempts to optimize your medication. This takes extra work. This requires a provider to really work diligently at your regimen, and then sometimes delays treatment for weeks, maybe a couple months at worst case scenario. But the reason why we want to optimize medications is to increase your chances of response and remission. If you're on a medication on a high dose that contributes to depression, like a benzodiazepine, and you don't really need to be at that high dose, it's absolutely essential that we work to taper you down. Now, some clinics don't see necessarily value in this or that that's a good use of their time, but we have found that that has been an integral part in our patients responding very, very well to TMS treatment. Medication optimization also includes whether the provider has found an underlying issue, such as ADHD. Now, it's not that you don't still have depression and treatment-resistant depression at that, but if you have underlying ADHD that's untreated and you start TMS, your results are going to be less than compared to if you treat your ADHD. So asking that question about medication optimization is really important. We know from personal experience and from competitors in our area and across the country that this is more of a rare thing, and we believe this should be standard of treatment, especially considering the time and the money that's spent on both insurance and providers' perspective. Medication optimization is incredibly important, so don't be afraid to ask about it. The next question we encourage you to ask is there a provider on site at all times? Whether it be a psychiatric mental health nurse practitioner or a psychiatrist. So we're not talking a TMS technician necessarily. They should always be on site and in your room at all times, or line of sight at the bare minimum, but we're specifically talking about the medical provider. This is yet again another standard that's not common across the country, which we find to be appalling, frankly. This is a complex treatment for treatment-resistant depression. Some of these clients have tried everything else they can possibly think of. Sometimes these clients are very ill, and they deserve that attention and that care and that diligence that is allowed when a provider is on site. It's also for safety. There is a small risk of seizure. We want to make sure there's a provider on site to manage that. We also are dealing with clients that can be experiencing side effects from TMS. We have personally seen an increased anxiety when the brain starts to wake up. We've seen agitation, insomnia. We've seen some impact where maybe the magnet and the delivery of it is painful, and different options that we can have. Having that provider on site is essential to making sure that the care is top-notch and that provider supports a TMS technician. We're not sure why this is not standard, but we highly encourage clinics to have a provider on site at all times. Not necessarily meaning a provider is in each room or there's one provider per patient, but that provider is available for all TMS technicians in that clinic. That is a standard that Duke University has established, and when we did our fellowship, we have continued that since the day we opened. The next question would be, do the providers have any TMS training outside of the certification from their machine's manufacturer? So what this means is every TMS clinic requires training and certification on their device. So whether it's a BrainsWay device or MagVenture or NeuroStar or Cloud TMS, anything that you probably have heard, they all require training at a bare minimum of at least 1 day of certification. We find that to just be too minimal. We believe that training should be much more extensive considering the level of care we're providing and we're treating people's brains. It's really important to have that intensive training, and we ourselves received our extensive training from Duke University. We did their fellowship and it was just absolutely wonderful. We got exposed to every device from providers around the world actually, and we learned an incredible amount and found ourselves to be much more thorough and educated providers after that training. And we're really looking forward to the in-person coming back. All of our psychiatric mental health nurse practitioners are going to attend fellowship at Duke University, and there's many programs around the country, and we just find them to be just frankly a necessity and should be a baseline of training. Another question would be, do the TMS technicians have any medical training or licensure? What we mean by this is all of our TMS technicians are either medical assistants or CNAs, certified nursing assistants. They have medical licenses. They are also covered by our malpractice. It's absolutely important that these technicians are trained and skilled, and if they have the certification from the manufacturer, that there's more training besides that 1 day. In our case, we have one-on-one training for a solid 2 weeks and then strong oversight for the first 90 days by an established TMS technician in our clinic. So the key takeaway here is TMS technicians don't have a standard of care in terms of their training, meaning that there is no education requirement or training requirement outside of the 1 day of training. Again, we find this to be subpar and unacceptable, and we would love to see some change. Another question is, does the technician stay in the room or at least maintain line of sight at all times during treatment? Now, this seems obvious, but what we have found is that this isn't always the case, and that many technicians are overseeing multiple devices. And really, to be safe and have the highest level of care, that TMS technician should be in the room at all times to witness any adverse effects or slight signs that something's not going correct. And not to mention that patients also enjoy our support and engagement if they choose. Another question, does the clinic use any therapy modalities during treatment, such as TMS workbook or anything CBT based? We at our clinic use the TMS workbook. This was a CBT-based therapy model developed by Michelle Cochran and other psychiatrists out of Tennessee, and we just absolutely loved this idea. We were exposed to this at the Clinical TMS Society annual meeting, and we have been a member ever since. So we pay a monthly membership, and every one of our clients are able to complete the TMS workbook, and each session is associated with an exercise. And we have found the data shows that responses increase when someone's doing therapy and TMS together. And that makes sense because neurons that fire together wire together. So next one, does the clinic redetermine motor threshold weekly? Now we do this every Monday, and if a client misses Monday, we do it on Tuesday, their first day back from the weekend. Why we find this important is, people drink alcohol on the weekends. We encourage people to limit alcohol intake, especially in excessive amounts or binge drinking, because it's of the danger behind that. But redetermining motor threshold is important if people have medication changes or significant sleep issues. And really, we do it every single Monday because it's important for safety and making sure that their treatment's optimized. So asking whether the clinic redetermines motor threshold is important. Now, insurance companies don't technically cover redetermination every single week. They often pay for one or two past the mapping treatment, but your clinic can still do this quickly during your regular treatment. Does the clinic have the provider available for questions and check-in with the client? This again goes back to the provider on site and making sure the provider is available to answer any questions. If the TMS tech finds that there's an issue with medications, or if there is a concern about treatment, or any questions for that matter, that provider is available and that provider has formed a therapeutic relationship so that patient feels heard and seen. Another question that we would encourage you to ask is, does the clinic offer additional weeks of treatment or booster treatments if you happen to be a late responder or have symptoms return before 6 months from completion? So previously we had a pretty strong response from a handful of insurance companies in our first couple of years of practice, where we noticed there was quite a few people that were late responders, meaning that they were starting to really get the ball rolling, typically end of week 5, and they were going to be ending at week 6. And we were able to negotiate with insurance and ask for additional 3 weeks of treatment. We did this quite often our second and third year, and we found this to be incredibly helpful and robust. And most people had that light bulb moment at the end of their 6th week, if not 7th week. And we kept, solidifying that into the 7th and 8th week. And unfortunately, insurance companies have decided that that's not something they want to do. But at our clinic, if we notice there's a late responder, we make sure that we take care of them, whether it's pro bono or for our fee, because we find that it's essential that all that time and money and effort that a client has spent is not all for naught. And I often compare it to a strongman contest, where you guys all know the event where a strongman pulls on with a rope a semi-truck. And I describe it as, we don't want our clients to drop the rope. Once those wheels start turning, that truck starts moving, you don't drop the rope. So that's where the extended treatments can come into play. We've also seen that there's a small group of people that really just need one treatment every other week, or sometimes once a week. And we have a group of times on our schedule blocked out for those people that they can come in and be seen. Sometimes insurance allows that, most of the time not, unfortunately. Another question is, do you have a follow-up visit after you complete treatment to see how it went? So in our case, we typically follow up at 30 days and 90 days, and sometimes again at 6 months, depending on what is said at those visits. Why this is important is the neuromodulation that occurs from TMS continues up to a year after treatment. So sometimes a client who leaves our clinic at the 6-week mark feels like results have been mediocre, or sometimes they feel like results have been fantastic. And we want to make sure that the results sustain, or if it's just been mediocre, that they start to get better. And if they don't, we do something about it. So making sure that follow-up happens, and it also helps with the medication management piece, where we can give a warm handoff to the next provider. And that leads me into my next question is, does your clinic coordinate care with your referring provider for a warm handoff? Meaning that how we run things with our clients is that when they're referred to us, we take over all of their care, meaning that we provide their medication management and their TMS. They continue therapy with their outside provider, which is best case scenario. But the reason why we take over medication management is for medication optimization, but also for safety, to make sure that we know exactly what they're taking and when, and we can fine tune it based on what we need to do. So coordinating care at the beginning of treatment, at the end, is really, really important. We can provide those refills and send them back to the referring provider. Now, the next thing I want to get into, that's, when on the notion of questions, it's a little bit more about the politics of TMS. Now, I understand that I've made some big statements that might be controversial, but Brendan, Julia, and I have created this standard and have never deviated from it, and we're very proud of this. What we are trying to accomplish is a shift in the way TMS treatment is delivered and managed. That we recognize that TMS is a complex medical procedure that needs consistent treatment standards. If you can't find a clinic that offers all these standards, the most important thing to consider is the experience, medical background, and training of your TMS technician. Is it the community soccer coach or family member of the owner with no medical experience whatsoever? Believe it or not, that's still allowed and is common practice. Start with your TMS technician. Now, another thing that we find to be really important is that, as a patient, you deserve a patient-centered clinic that isn't run by businessmen or women with no medical licensure, that are more concerned about bottom dollar and their shareholders over patient care. You want a clinic run by a medical professional who is held to medical ethics and licensure, who oversees patient safety and understands the complexities of TMS. You're spending a lot of time and money on this, and you shouldn't be just another number. On more than one occasion, we've been approached by venture capitalists and other clinic owners who want to partner or acquire our clinic. We've always refused this because they tell us they can't or won't maintain our standards. We've witnessed local TMS clinics fall victim to this movement of businesses taking over medical clinics and compromising patient care. We get pushback about being able to afford a provider on site at all times, and we frankly just don't understand this resistance, as we've always been doing this for 4 years since we've opened. We've heard that the goal is to expand as quickly as possible to provide access to TMS, and while we are all about increasing access, it cannot be at the cost of patient care. If you live in the Vancouver, Washington, or Portland, Oregon area and need TMS, come to our clinic. We have held ourselves to a high standard of care from the start and would love to treat you. Don't forget that as a consumer and patient, you have influence. If you insist that these standards become mainstream, things will change. That's supply and demand. Don't be discouraged by the inconsistencies that exist now. As a patient, you have more power and impact than you think. Don't compromise. Keep demanding, establish standards and clinical excellence, and change will happen. Good luck on your journey, and thanks for watching.